Millions more people can get a booster shot of the COVID-19 vaccine.
Tonight, the CDC endorsed an expanded booster rollout. The Pfizer booster has already gotten the green light. Now the CDC is signing off on booster doses of the Moderna and Johnson & Johnson vaccines. The CDC director also gave the green light to mixing and matching boosters. Anyone eligible can now choose whichever vaccine they want for their booster shot.
Fox 5's Drew Andre joins us now to break down who's eligible and when you can get it.
Well, John and Kim, vaccine sites around the valley can begin administering booster shots for Moderna and Johnson & Johnson tomorrow. And mix and matching now gives vaccine clinics options.
Take your pick. That's what the CDC's decision means for vaccinated Americans with the approval of Moderna and Johnson & Johnson boosters and mixing the vaccines.
It really comes down to making things a little bit easier for those of us who have to give the shots. You don't have to worry about making sure you have the same booster as you had the original one. So if we're going out to do a booster campaign somewhere, we don't have to bring everything with us. We can just offer one of them, and anybody who shows up would then be eligible.
But who qualifies differs. For Moderna, it's recommended to get the booster shot if you had the shot 6 months ago or longer, or are over 65, have underlying health conditions, or are at an increased risk of exposure because of your job. On the other hand, the CDC recommends everyone that received the one-shot J&J get the booster because that vaccine has slightly lower protection. CDC officials are still working out whether to recommend people stick to their original vaccine if possible, but say it is safe to mix.
You don't need a doctor's approval as to which one to get. Basically, we're treating the vaccines as the same, basically, when it comes to the booster. So it's the same thing we do with other vaccines. If you get a measles shot, we don't care what brand you had when you get your next measles shot or a tetanus shot or something like that. And we're seeing the same thing here. We just needed to put the evidence together to show that that was going to be an effective approach.
The Moderna booster shot will only be half the dosage of the original 2 shots, which Labus says will benefit the U.S. and beyond in the long run.
There's been a lot of ethical concerns about Americans getting our third doses when a lot of the world hasn't gotten a first dose. So the more we can stretch that vaccine, the more people we can vaccinate.
And Labus says the only reason Moderna and J&J received the booster approval later than Pfizer is because Pfizer was the first vaccine to be approved late last year. Reporting live in the studio, Drew Andre, Fox 5 News, local, Las Vegas.